Hello and welcome to another edition of Community Tapestry. My name is Napoleon Bell and I'm the Executive Director with the City of Columbus Community Relations Commission. We have a great program in store for you, so I know you won't want to get up out of your seats. Our first segment, we're going to be speaking with an officer about what he's done in his daily routine as a police officer, but some of the things that are more critical that he's been through in regards to using his firearms. So we really want to dive into this deep. So let's go ahead and get started. Let me first turn. Officer Wendell Tober, I'd like to welcome you to the program.
Thanks for having me, Director Bell.
This is, a life as a police officer, and I think sometimes people don't get to hear and understand that, but let's back up a little bit before you started as a police officer. You're a family man, right?
I am.
Okay, so you've got a family, and how long have you been a police officer?
Be 18 years in November.
18 years. Now, 18 years, a lot of things can happen in 18 years, but why 18 years ago did you decide, especially as an African-American male man, why did you decide to become a police officer?
Director Bell, actually it's kind of funny because going back to the academy, the sergeant in charge had each one of us stand up and say why we wanted to become a police officer. Well, 99.9% of the class stood up. Well, 99% of the class stood up and said, hey, ever since I was little, ever since I was young, ever since way back when. Mm-hmm. Well, I stood up and said, well, I was looking for a job at the time, and knowing you and being a police officer at that time, I said, hey, Napoleon, can you get me a hand on any state, city jobs, county, out there, because you're out there in that area. So you say, hey, well, why don't you be a police officer? I said, no, that's not for me. You're a police officer, some of our friends. I have family that are police officers as well. I just didn't think it was for me. I mean, you got to put your hands on people, their personal area, things like that. I just didn't think it was for me. And then you said, well, just think about it and, just do a ride along with me. Well, I thought about it. I'm still looking for a job because my job I had, it was going well, but something just told me, hey, look for something a little bit more stable, benefits for my family and so forth. And I thought about it. I called you up. We did a ride along, and you probably don't recall that because at that point, you've done 1,000 things yourself, and some things come and go. Well, that day, within that hour, for whatever reason, man, it hit me. This is what I want to do.
Oh, wow. Okay.
Next test came up about several months later, took the test, and here I am.
Wow. Okay, so all it really took was a ride along, and this is to be able to ride with an officer to see what they do during the day.
Exactly.
And so that was the selling point. It says, this is what I'm here to do.
It was.
Okay, so it wasn't the, get the cat out of the tree or this, that, and the other, but this is something that, you felt as though you can help people? Or,
yes, exactly.
Okay.
Exactly. I mean, just that short time, you made a difference in a couple individuals' lives with their situations. They may have not been important to most people, but bottom line, it was important to those individuals at the time. And I thought you handled it well, and I was like, well, wow, they appreciated your help, your presence, the whole 9 yards. I'm like, okay, maybe I can do this.
Mm-hmm. Well, apparently after 18 years, you've done a great job at it. And that's a good thing, because I think that when officers do a great job and they're out there in the community, and it sounds like you have passion and for the community that you work for. Now, and what area of town do you work?
I work 9th Precinct, which is basically squared off by Winchester Refugee on the south end. I would say 70 and Livingston would be the west end. The north end would be basically Broad and James, and the east end would be basically Courtright and Livingston. So Eastland Mall, Main and James, Broad and James,
okay,
in between Bexley and Whitehall.
Okay, so a relatively busy area, but pretty diverse, I think,
exactly.
Area. So,
yeah.
Okay, so with that being said, you've done well, and you're in an area that you appreciated, and that you enjoy working. Sometimes I think sometimes that doesn't go the way that you expect it to go. And what I wanted to talk about definitely is that I understand that you had been involved in a shooting. And, you know, many officers are, you know, never are in shootings during their entire career.
Correct.
And you're one of those officers that has been in a shooting. Now, as I understand it, that no one was fatally hurt in it, which thank goodness of that. But tell us about the incident and what it was like when you were involved in this shooting.
Well, you know, it's interesting that you mentioned quite a few officers go through their careers without even firing a weapon. I thought it, I really did. From get-go, until that day, I thought I'd be one of those officers. For whatever reason, I just never thought I would have to use my gun. Now, I also had a mindset, if I needed to use it, I'll use it. In this particular instance, I did. Called on a burglary report. Suspect.
So a simple burglary report.
Correct.
Okay.
5 minutes later, I'm in a shootout. Literally, approximately 5 minutes later. So I pulled up to the residence home, knocked on the door. She allowed me in. She proceeded to tell me what happened. And then she proceeded to take me back outside the residence to show me where the attempt break-in was made at. Well, stepping outside of the residence, at an officer, you just naturally scan your environment. Well, I come out the door, immediately look to the right. Well, to the right of me at the corner of Plymouth and Barnett is 3 individuals, 2 guys and a gal. Well, the 2 males, I see them face to face as though there was some kind of confrontation going on. Well, one particular male, we all knew him from the streets, and he knew me, I knew him, knew his family, and it was kind of notorious in the neighborhood. And at that point, my threat level was real low, and that, hey, you know, this is just a little verbal confrontation between these 2 individuals. So I yelled over, hey, take that somewhere else. Proceeded to talk to the victim about her residence, and I scanned back over there, and they're still going at it. And I yelled again, hey, I told you to take that somewhere else. In the meantime, after I yelled that, the suspect, I believe it's his right arm, as he's looking at the other individual, extends backwards, which I didn't understand that. Well, next thing you know, I hear pow, pow. So 2 gunshots into the ground for whatever reason. At that point, I turn around, my weapon comes out, I point it towards him. As I'm walking towards him, tell him to drop the gun. Now, let me back up a little bit. For whatever reason, just prior to, as I pulled my weapon, my mindset was, well, he's going to see me, he's going to hear my commands, he's going to drop that gun and throw his hands up. And only that too, he's going to recognize it's me because I know him.
And you've already said something over to them
Yes.
to take that somewhere else.
Correct.
Okay, so they knew there was an officer over there.
Yes,
Yeah.
Okay. But I think they were so involved in their argument, disputes, whatever you want to call it, they kind of, just didn't pay too much attention to me.
Right.
And this individual too, again, I have many encounters with him and some of his family in the street. So my mindset was, oh, well, he's going to see me, recognize 1, I'm an officer, 2, hey, it's Wendell, it's Officer Tober.
Right.
Let me drop my weapon and go. I come at him, I'm walking towards him, weapons pointed at him, directly at him. In the meantime, as I have my weapon pointed at him, I'm concerned with the individual next to him, and then there's a female too behind him. So loud commands, drop the gun, drop the gun. He looks, as he's still looking at the individual, he hears me, looks to the side, his arm immediately comes up, gun pointed towards me, pow, pow.
Wow, so he is now fired shots at you.
That's correct.
Wow.
Yeah. So at that point, I just went into a crouching position, kneeling, hoping that no bullets are hitting me. And I returned fire immediately.
What are you thinking when you're hearing this? You're saying, this guy is shooting at me. He could, these shots, were you thinking that you were hit then because he's shooting at you? And you're thinking, well, the bullets are going somewhere. Am I hit? What's going through your mind right then?
Well, I was thinking more, I hope he doesn't hit me.
Okay.
And in the meantime, it's like a car accident. People say 1,000 things go through your mind that quick. 1,000 things went through my mind. And I really, truly believe my training kicked in because my thought pattern was, okay, well, he's shooting at me. I hope he doesn't shoot me. Oh, where's the lady at that I was talking to, the victim? Hopefully she went inside. Now, no, this is going
Because
through
the
my
bullets
head.
are going past you,
I would
she could have
assume
been
they
hit.
would, because
Right.
he was pointing right at me. So my thought pattern is on her, and then, okay, well, where's the individual he was arguing with? I don't want to hit them. And where's the young lady at? I don't want to hit them. Oh, what about my backdrop? Okay, who's behind the suspect? The suspect shooting and running. I'm following him with my gun and shooting. So, okay, what's behind him at that point? Well, there's some brick buildings there. I hope nobody's standing out there. I got to stop this threat.
Right, so you're returning fire while he's running and he's shooting at you at the same time, but you're not only thinking about trying to stop him as a threat, but also worrying about the backdrop on which you're shooting, because you don't want to hurt somebody that if you miss, where's that bullet going?
Correct. Correct.
And he's not thinking about that at all.
Of course not.
Okay. Okay.
So he eventually ran between two buildings. For whatever reason, man, the first thing I did was drop my clip, put another one in there, and aired, shots fired, I've been shot at, this is where I'm at, and so forth. And the instinct was to go after him. So I went after him, went looking for him, couldn't find him, and before you know it, the troops show up. And I told him, I said, listen, here's a couple apartment buildings. I said, I bet you he's in this building here. I don't know why, but I told him he's got to be in this building. So they immediately whisked me away. So once you fire your weapon, they want to, take you up, take you somewhere safe, which they took me to a nearby firehouse, and also got on the horn for our attorney.
Okay.
So in the meantime, they were looking for this individual. And I would say about half an hour later, they come get me to identify someone. So I distinctly remember walk up to the wagon, and I have a few thoughts that I wasn't real happy with him.
Right, right.
And once I saw him inside the wagon, everybody just, when I nodded, they knew that, hey, let's go ahead and get you away from him.
Right, right.
But he immediately said, Officer Tobler, what? I apologize, I didn't know you, he knew
Who you were, right.
Exactly. Couldn't find out, it was kind of interesting because they did find him in the building I said he was in, and they searched each building. Well, when they were ready to give up, I believe K9 dog kind of hit on a dryer in the basement.
Okay.
So sure enough, he was in the dryer.
He was in the dryer.
He was in the dryer.
Oh my goodness.
And they found a weapon right above the rafters in the basement.
Okay.
So they whisked him off. I believe he got about 7 years out of it.
Okay.
And it was a very interesting night.
Wow. Well, that is very interesting to go through that, and then to have the individual actually says he's sorry for shooting, because you knew him. There was a relationship in a sense of that. There was, I don't know, you almost say that respect as far as on the street.
Right,
What they're into, and but you're giving them their space. So that's very interesting. So you said that the officers then took you off to the fire house. Is there also, do you have to also, because this seems like a very traumatic incident, being shot at, bullets coming at you, but then also having to return fire, and even though nobody was hit, there's still traumatic of the incident happening. Did you have to speak with a psychologist or psychiatrist to get some help to work through these things and make sure that you were okay mentally?
Yeah. Procedure is to, I believe within 3 days, go and talk to one of our psychiatrists. And I did, paid a visit there, and he asked me a few questions. Said, hey, I think you're okay, go back to the street. Me personally, at the time I was married, I asked my wife, hey, I seem okay. Matter of fact, I would ask her on a regular basis. I would say a regular basis, I don't know, once or twice a year, 2 times a year. Am I bringing a job home? Because I don't want to do that. I don't want that to interrupt my family life, my personal life. Mm-hmm. And she always said, no, you're fine. So even given that time, I was okay in my mindset. And I really truly believe that my faith helps me quite a bit. And to be able to put this gun back on and go back out there on the streets.
Wow. Wow, that's amazing. Well, I had to look up some statistical information, and from the FBI, it shows that 51 law enforcement officers were feloniously killed in the line of duty in 2014. This is an increase of almost 89% when compared to the 27 officers killed in 2013. So, this type of increase, first of all, but then, just the knowing that you could have been killed in the line of duty when this happened. Now, this is one time. Were there other times that in your career that either you had to use your weapon or that you were fired upon?
Yeah, well, no other times that I'd used my weapon, but fired upon, yes. I think it was a year for me to be shot at. I can't think of the year, but there were several shootings in a row, and I would say 2 to 3 months apart. I know there's one on East Livingston at Courtright. Several of us, we just finished a disturbance call. We're sitting there talking, someone shooting across the street from us. Another one was we're checking out a vacant building. Suspect supposed to be around somewhere. Next thing you know, somebody started firing. You hear bullets hitting you back of the wall behind us. So we're trying to go where, and that's just it too. As they're shooting at us, or as they stop, we're immediately going where the bullets are coming from. Oh, I recall another instance at a nightclub. They were letting out for the night. Everything was actually I was taking an accident report, and actually, you just hear a ton of gunfire just going crazy. And you can literally hear the bullets going past you.
Wow.
So there were several times that happened. I had people try to take my gun on several occasions. I had to fight for that.
Now, have you ever been hurt out of these fights and things you've been through?
Yes, one occasion, the big fight, as a matter of fact, the same bar, big fight breaks out, everybody's all over the place. We're trying to get people to comply. One individual really got out of hand. I went to place my hands on him and place him under arrest for not refusing to leave when we told him to leave. He became very violent. Another officer came to assist me. The officer took and grabbed him. We all go down. I had mace in my right hand. My fist goes down to break my fall. Next thing you know, my wrist is about twice the size it normally is. I managed to put my mace away, get my cuffs out, and still put the cuffs on this kid. And at that point, once everything was said and done in regards to him, that he was secure, I stood up and said, that doesn't look good. And happened to be a squad around the corner.
Right.
Took me to the hospital, put it back in place. Here I am.
So you broke your wrist.
Yes.
Lord have mercy. So, with all this that you're telling me about, all the shootings, or the shooting, being shot at multiple times, the fights that you've had to deal with as an officer, and I got to ask the question, why do you keep doing this? Why especially in today's time, things that are going around that are happening nationally in regards with police, why continue to do the job when you have all this that you're dealing with out in the community and you're doing it for the good of the community? Why continue to do it? I think for some people that are watching would say, that is not the job for me, and I don't understand why people would continue to do it.
Sure, very understandably too as well. I think early on I was always somewhat of a protector, whether protecting my little sisters or some family member from the bully, neighborhood bully, or whatever. And I like to help wherever I can. We just grew up in that atmosphere. You help one another, you help the elderly. You pick up behind yourself. You serve the community if you can. You help the poor and so forth. So I think I just had that helping spirit. So the job gave me that opportunity to make a difference in someone's life somewhere, somehow. And one thing I try to do is that remember that this is a job of service. It's not always just about writing tickets and taking people to jail. Sir, ma'am, how can I help you? And again, just because their situation may not be that important to me, it's important to them. So I got to treat it that way because I would want to be treated like that, or my family member and so forth. So I try to take that in consideration when I'm, out there and about. And not only that too, some decisions we make, it can have an impact on someone's life for the rest of their life. So I think it's important that I take my time and make the best decision I possibly can, because behind this badge and gun, there really is a lot of power. But I don't think it's anything that we should take to our head and run with it. Again, this is a job of service. So again, along with just wanting to help, wanting to serve and everything, it does my heart good because I don't do it to impress anybody. I'm not trying to be the best officer. I'm not trying to be anything than Officer Tober, who said, which is badge, and this oath that I took says that, hey, you know what? I have the ability to help make a difference in someone's life. So even with the foot chases, fist fight, car accidents, and many a time to watch people take their last breath, or watch people lose their loved ones, and so forth. And if I could be there for them for that time and that moment, you know, I like to do that. Although I'm not a family member, I'm still someone that is a stranger who is a servant that says that, hey, look, yeah, I'm a police officer, and I don't know you, you don't know me, but I can still be here for you to the best of my ability as a police officer. So given that, I guess I just like to serve and make a difference in my fellow man and help our work in.
Wow. Well, it sounds like, you know, you're not just the person who enforces the law, but you are able to have empathy and compassion for the people that you serve, and not necessarily a law enforcement aspect, but in times of need. You know, when you see someone passing or you're dealing with that, or I'm sure you've come upon car accidents where there could be fatalities and so on and so on. And you know, with all that, and I think that's, you know, tremendous that you're able to do that, and I would hope that so many officers would work the same way. How do you deal with that? I mean, you know, because we talked about the shooting piece and all of that, but how do you deal with seeing such persons that are, you know, that are struggling through life and through an incident that has happened, that, you know, there's death and there's dying, and how do you stay positive through all of this and dealing with that?
You know, one of the things they taught us in the academy earlier on was that have friends and not just police officers as friends. You say have friends, have family members as your friends, have friends outside of departments. Because what we tend to do as police officers when we're friends and buddying up, well, we tend to talk about police work instead of letting it go. I'm thankful that I have a huge family. As a matter of fact, my grandmother, I believe she's going to be 103 this year.
Really?
Yes.
Grandma, what's Grandma's name?
Mary King.
Grandma Mary, well, 103, when this year?
You know what? She actually took away, I believe her birthday is in October.
October. Well, happy birthday, Grandma.
Yes. And I tell you, man, her mind is fresh as yesterday, and she is the catalyst of this family. But she's got a good heart, a good spirit, and that, you know, part of where I am today, I owe it to her. And but again, going back to our family, we have a huge family, and I don't say always, but I brag about our family a lot because it's a good family. We're perfect, no, but it's a good family. The get-togethers are always a good time. So I think with that and the love that we have, you know, I've got that support. I got my kids who I love dearly, who love me, and again, my faith. You know, without that specifically, I don't think I'd be as well off. I can't speak for every other officer, but I think for the most part, I think the division itself, Columbus Police, does a very good job at making sure that our officers have access to EAP, employees
Assistance program.
Yes, and you know, our counselors and so forth, therapists, and you know, of course, our insurance allows us to do that too. And I'm not seeing too many officers dramatically have an effect, but I have seen one or two where they had to use their weapon to fatally shoot someone. So I'll take a toll on them, but still you have officers still here who says that, hey, I'm still going to stay in the fight and keep moving forward. So, but I think for me, I think family, faith, friends, it helps me out quite a bit.
Wow, family, faith, and friends is your support structure to allow you to continue doing the job that you were doing and making a difference out there in the community.
Yes.
You know, I applaud you, and I applaud, you know, all the police officers that are out there that continue to do the job. What would you say to someone who's looking to sign up, but is still hesitant because of all the things that are going on, but you know is on that fence? What do you say to that individual who says, hey, you know, come on with us with the Columbus Division of Police?
Well, I recall years ago, my daughter came home and she said, well, looked at us, what matter, sweetheart? She said, well, kids are at school are talking about me. And I said, well, what are they saying? She gave me some specifics. I said, well, listen, honey, I said, first of all, you're perfect to me. But no matter what you do, what you look like, what you say, somebody somewhere is going to have something bad to say about you or something negative. Okay, but you've got to be confident in yourself that you like who you are. If you don't like some things about yourself, then change it, but you change it for yourself. My point of that story is this here. If I had someone who's interested in coming on, that, hey, listen, you got to understand that you can do all the right things. And someone can say, hey, you know what? The officer looked at me wrong. I don't like that. And I don't like his demeanor, so, but you had all the right intentions. You can't let that bother you in regards to doing your job. You got to do it to your best ability. Is it dangerous? Yes. But the division trains us very well to where, one, not only can we protect ourselves or have the equipment to protect ourselves, the backup is there pretty much almost in an instant. So overall, considering the danger of the job, it's pretty safe. And then last but not least, I would just encourage everyone not to forget that this is a job of service. Sir, ma'am, how can I help you? Yeah, we all want to catch the bad guy. I want to catch the bad guy. It does me. I like catching the bad guy. Get him off the street, especially if he robbed you, your family member, your home, assaulted you, what have you. Hey, let's get him off the street. But there just come those times to where we just need to, one, respect people, two, remember again, hey, we're here to serve you. How can I help you today?
Well, so many things that you've talked about today, I don't think the average resident gets to hear that and to understand that about a police officer and being in the shoes of a police officer, not only at work but at home. And you talked about making sure that you do not take that home with you, and that seems like it's an important piece. Do you hear that? I mean, you said that, but that was told early on in the academy about making sure you don't take that home with you.
Correct.
So, 18 years. What do you do then to do you spend most of your time with family after you're off work and you're done? Is now it's family time and you hang up the hat and the uniform and say, I'm dad now.
Exactly. And that's just it too. Right now, my kids are the most important thing to me. We just got back from Myrtle Beach. And we had a great time, fantastic time. So, and then even at home, hey, it's time to spend time together. That's what I enjoy. Do I like some me time? Sure I do. But my focus is on them. And then my extended family, my relatives and so forth, our get together. Mine is kind of like the gathering house. But again, with that in mind, that helps keep me grounded. I like to work with my hands. I like to build things, work on things around the house, fix things, anything to say that, hey, you know what, my mind doesn't have to stay on the job. So
it seems like, you don't want to be I'm always a police officer on duty or off duty, and I'm, out there in my regular car looking for the bad guy type thing.
That's correct. Speaking of which, I will give an account of an off-duty incident because we're required to carry a weapon 24/7. And I don't think that's another thing that the public is aware of. And not only that, I don't think they're aware of that, hey, 24/7, we're a police officer.
Right.
But
whether you want to be or not, you're a police officer and you were sworn to uphold the law.
Correct.
So.
Yeah, and not just turn my head the other way. And I think, I know for a fact, most of the time, most individuals don't know they're sitting next to a police officer in a restaurant at the BMV or what have you. But I'll give an account of another gun story. One night I go to a gas station to pick up something, snacks or something like that. It was just a quick run in, run out. But my mindset before I left home was get your gun. Get your gun and your badge, which we're required to do anyway.
Right.
I have to admit, for a second there, I was like, I don't need that. I better take it anyway. Get to the gas station, run in and grab my snacks. In between the pumps, there's a car, another car, two individuals, actually two individuals and one standing to the side fighting. Let me call it in. Well, next you know, the third individual comes out with a shotgun. Hey, there's a gun run now. I stoop down my truck, my gun comes out. I'm just keeping an eye on the situation at that point, waiting for backup to get there. At that point, I believe the suspect with the gun heard the sirens coming. He goes to put the gun back in the car or get back in the car with the gun. Well, instead of allowing him to get back in the car with the weapon, not knowing what he's going to do with it, take off, whatever, and just not seeing where it's at, I decided to get out with my badge. I believe I have a chain with my badge on it, badge with my chain on it, chain with my badge on it, and made it known. Comes police officer, drop the gun, get down on the ground. Thank God everybody complied. I don't know if it's because the sirens they heard coming or what, but everybody got on the ground. I held my gun point until everybody got there for backup. Had to do a report, get back home, and call it a night.
You know, it sounds like everybody should do a ride along with you because they're going to be busy regardless, whether you're on duty or off duty.
9th Precinct, they are.
Well, Officer Tolbert, it's been tremendous having this conversation with you. I'm hopeful that the community gets has watched this and has insight into what an officer goes through, but also not just the work, but other things that impact his life and of your life and others, their family and their friends and faith that you continue to work by. So I really appreciate what you're doing out in the community. Continue to do it. And we'll be right back after this message. Welcome back to our second segment of Community Tapestry. And if you're just joining us, my name is Napoleon Bell, and I'm the Executive Director with the City of Columbus Community Relations Commission. Over the past couple years, there's been an issue that has come up, that has come to light in our community and several cities, dealing with infant mortality and how it has impacted City of Columbus residents. And so I'm pleased to have two individuals here that have been in the trenches, really working in this arena under a new program that has been set up and kicked off in November of 2014 called Celebrate One. So without further ado, I'd like to first introduce on my left, Ms. Leanne Eagle, and she's the director of Celebrate One. Welcome to the program.
Thanks, Napoleon.
And then to my right, I would like to introduce Erica Clark-Jones, and she's the director of community strategies for Celebrate One.
Thanks, happy to be here.
Welcome both of you to the program, and this is a very serious matter. It's something that I'm glad that both of you are really working on this and really working to address it. But let's take a step back and let's talk about what is infant mortality. And let me speak with you first, Leanne.
Sure. Infant mortality actually describes deaths of infants before their first birthday. And it really is recognized as kind of an indicator of the health of a community overall. But we're talking about babies that die before they turn age 1. So it's a serious issue. It's a tremendously sad issue. We know that here in Columbus, for example, about 150 babies per year die before their first birthday.
Wait. You said 150 per year, so that's almost one every other day. Mm-hmm. That die here in the City of Columbus.
Right, and when you think about that's like 3 kindergarten classrooms full. Those are babies that are dying. And so it's tremendously sad, and there's, as we're going to talk about today, there's things that we can do to prevent that. We may not ever be able to prevent all deaths, but we're working towards that. And we really don't want any babies to die. We want babies to make it to their first birthday and then thrive well beyond that. And that's really the mission of Celebrate One.
Wow, that's an incredible mission. It sounds like a long road ahead, but we'll talk about that more. Well, let me turn to Ms. Jones here. Why are we so concerned about this, in Columbus?
Sure. Well, the U.S. overall has a problem with infant mortality, and we recognize that. Throughout the Greater Columbus Infant Mortality Task Force process, they collected data with the help of the Kirwan Institute at The Ohio State University. but the U.S. ranks 32nd out of 34 countries
My
globally.
gosh. 32nd, that's almost last out of 34 countries.
That is correct.
That's incredible.
Well, it gets worse, unfortunately. Ohio ranks 46th out of 50 states in the United States as having just a tremendously high infant mortality rate, and that's statewide. Additionally, Franklin County, out of all 88 counties in Ohio, Franklin County is 71st. And then Columbus, out of the 50 largest cities in our nation, Columbus is 36th out of 50. Our infant mortality rate is twice that of New York City's. So we have, I think most of our city leadership and none of us as trustees in our Columbus community feel that this is acceptable, and we need to change this.
Well, I mean, this sounds like a crisis issue because, I mean, when you think about your day-to-day living, it's like, okay, another one passed, another one passed. You know, well, what are the causes and, you know, are the key drivers of this? I mean, what contributes to the infant mortality, either one of you?
There are many things that contribute to infant mortality, but what we're really focused on are what are those key drivers, as you said. What are the key causes that we can work on to prevent infant mortality? And so we know that there are probably four things to begin with. So it's babies born too soon, premature births.
Okay.
Those babies are at risk for dying before their first birthday. Babies born too small, congenital abnormalities. There's also a significant number of babies that die that are a result of sleep-related deaths. So how they're put to bed, and we'll talk about that as we go further, but sleep-related deaths. And then certainly health inequities that Erica can speak to contribute significantly to our overall rate.
Okay, well let's go to that. I mean,
Sure.
What about the health inequities?
So we realize that the social determinants of health, the things that happen in our daily lives, have an impact on our health. And sadly, high poverty rates, people that live in areas where there's high unemployment, unstable housing, lack of quality food access, and access to prenatal care all play into birth outcomes. And the stress of mom before she has that child or while she's pregnant contributes to babies being born too small and too soon. We know that, and that's one of the things that we are aiming at with one of the strategies in the Celebrate One plan, is to shore up our neighborhoods and the people that live in them to reduce that maternal stress before they deliver.
Well, it sounds like, you know, when we talk about the health inequities, that this is going to be in concentrated areas of low-income areas.
Correct.
It sounds like based upon what those factors are. I mean, because I don't think we'd see this in a, you know, higher up income level producing area that has the prenatal care and those type of things that you're speaking of, other than maybe, you know, when you have a SIDS death and or someone rolling over, you know, their sleep. But that is amazing. So you talk about Celebrate One. So what is Celebrate One?
Celebrate One is this community's effort to reduce infant mortality, and it comes about through the Greater Columbus Infant Mortality Task Force, which convened late in 2013. Columbus City Council President Andy Ginther recognized a serious problem and said we need to do something about it as a community, not just as the city, not just as the health department, but as the entire community. So he convened a very large task force with people from health, people from community, really from industry, a lot of great minds to kind of understand the problem and understand what we as a community can do about it. That group met over several months in 2014. They concluded their work probably in about July of 2014, and at the end of their work they came up with a plan, and that plan is recommendations, a set of recommendations on these are the things that will really help us reduce infant mortality in our community. So that plan was the result of the task force work. Celebrate One is this collaborative to move forward that work. So I'm the director of Celebrate One. My job is to kind of work with the community partners that are charged with the responsibility of these initiatives and make sure we're all moving forward, we're all following the plan and making progress to reduce infant mortality.
Well, and you talk about the plan. What is that strategic approach? I mean, I'm sure a lot has gone into this. So now, how, you know, what's that strategic approach to really address this issue?
And it's really looking back at those key drivers. So we know what are the primary causes. So what can we do to reduce those, to really impact those causes? So we kind of have an approach that falls into three areas. We're looking at what can we do to assure healthy moms and moms-to-be, healthy babies and healthy communities. When we talk about healthy moms and moms-to-be, we know that the healthier a woman is before she even becomes pregnant, the more likely she's going to have a positive birth outcome. So we want to make sure that just all women of childbearing age have access to health care, primary care, specialty care as needed. So that's one of the things that we're doing, trying to make sure that all women have access to insurance, whether that's Medicaid or private insurance, that they're able to get health care. Then when we talk about pregnant women, we want to make sure that they have access to prenatal care as soon as possible in their pregnancy. The sooner you get into prenatal care, the sooner any challenges can be addressed, and the healthier the birth outcome is going to be. So again, it's making sure they have insurance, making sure they know where to get prenatal care. We're going to be setting up an intake and referral service that women in this community can call one number and find out where they can get prenatal care, regardless of how they're insured. So healthy moms and moms-to-be, we want to make sure that the prenatal care that exists in this community is of the highest clinical quality. So we're working with the hospital systems and providers in the community to make sure they're at the cutting edge of what really works in prenatal care. And then working with moms to make sure that postpartum they have care, that they're breastfeeding and those kinds of things. So that's kind of the healthy mom piece. For healthy babies, we want to make sure that babies are brought home to a safe, stable home, that they're not exposed to tobacco smoke, so helping moms and family members with tobacco cessation, those kinds of things. And then we also want to make sure that babies have safe sleep environments. We know that sleep is, improper sleep practices is a major contributor. So what can we do to make sure these babies are put to bed in a safe place and properly, that's going to reduce their risk. And then that final area is the healthy communities piece, and that really gets at what Erica was talking about with the health inequities, and Erica's really working kind of to get into the neighborhoods and impact that piece.
Well, it sounds like there's a lot of education that's going to have to go on here, because you're talking about working with these young women about before, during, and after, and it's all about that care. And so we've talked so much about, you know, the different aspects of the strategy. I'm sure it takes, you know, nobody can do this alone. And so talking about partners and collaborations, tell me a little bit about the partners and collaboration that it takes to make this happen.
We are fortunate, Napoleon, to have some really dedicated organizations and individuals that have said, once they learned about how serious this issue is, what can we do to help it? So our partners are many. For example, the City of Columbus has really stepped up in a big way. Both the Mayor's Office and Columbus City Council are providing funding and support for the effort. We're also working very closely with Columbus Public Health. They've been in this game trying to work on infant mortality for years, so they have a number of strategies that they're working on. Also the Columbus Department of Development, both from a planning perspective and also with their housing work and in their neighborhoods, they're supportive. The county has stepped up in a big way. The Franklin County Board of Commissioners are providing financial support. We're also working with Franklin County Department of Jobs and Family Services, the Franklin County Families and Children First Council. So those are some government entities that are working with us, but then we have the hospital systems. All 4 hospital systems in this community are really dedicated to supporting these efforts, whether it's in a clinical capacity or community outreach. We're also working with the Central Ohio Hospital Council that kind of oversees. They're a partner for us. Ohio Department of Medicaid is a partner. So it's groups like that that have said, whatever you need us to do, we'll jump in and do it. Nationwide Children's Hospital, they have a Partners for Kids. They're looking at making sure teens are healthy, especially young female teens, so that, again, they'll enter pregnancy as healthy as possible whenever that may be. So there's really a lot of good support in this community, and people are enthusiastic and really passionate about the work that they're doing.
Yeah, it definitely sounds like, I mean, and you know, when you talk about it takes a village to raise a child, this literally, everybody is on this to wrap their arms around, you know, these young mothers and these young babies.
And get them to their first birthday, absolutely.
Get them to their first birthday.
And
If I could add, to that list of partnerships, I would also include a lot of our faith-based institutions in all of our neighborhoods across the city, and our community-based institutions, people that are boots on the ground in the neighborhoods. They are also in partnership with us. And so when our larger partners want to, you know, push out initiatives and programs and funding for programs, our community-based organizations, our civic groups, our area commissions, everyone is paying attention to this issue, and they want to help as well.
Yeah.
So they are also included in the partnership.
Wow, well, you talk about the neighborhoods and boots on the ground. You know, well, what are those neighborhoods that Celebrate One is focusing on?
Sure. Well, there are 8 neighborhoods where we know the infant mortality rate is higher than that of the general community. In some of these communities, it's almost 3 times higher than our Columbus community.
Wow.
But they do include the near South Side, They include the Near East Side and South London. Those are our Phase 1 neighborhoods where we are wanting to work in those communities this year. Additionally, Hilltop and Franklinton are also neighborhoods of concern, as well as the Morse Road 161 corridor, the northeast section of our city, as well as the southeast section around Eastland Mall. Those are our 8 high priority communities.
Wow, and so you talked about working on 3, focusing on 3 this year.
Correct.
Will that be 3 every year, or we're just going to see how things
Well,
roll?
I think, we had a really great opportunity to work with the Ohio Equity Institute, a partnership with our Ohio Department of Health, and City Match, which is a national organization that cares about these issues. We had a great opportunity to work with them on the far south side over the last year and a half. And we've learned a tremendous amount about creating interventions that work in the community and bring folks together, expand the capacity, and wrap their arms around new mothers and new babies. And so what we've learned from there, we are taking it and applying it to our Phase 1 neighborhoods, South Linden, Near South, and Near East. We also think what we'll learn from working in those communities, because every community is different, we'll be able to apply that to the remaining 5 neighborhoods.
Wow, so when we talk about boots on the ground and these neighborhoods, well, how do you, it's such, it seems like such an incredible problem, and you're talking about larger neighborhoods. How do you engage all these residents?
Sure. So again, having been informed, one, by successful initiatives like the Southern Gateway Initiative on the South Side and the Ohio Equity Institute, we started community conversations. And what we learned was there are probably a series of conversations that have to be had. A lot of them are about the quality of life in our neighborhoods. It's about race and the stress of having racial tensions and community violence and the things that impact the health of people in their neighborhoods. So we have forums to talk about this. So our community engagement series is 6 meetings happening in the first 3 Phase 1 communities over, I think it's over 12 weeks that we're having these conversations. They started in June, and they're going through the beginning of September. And we invite everyone to come, whether you live, work, worship, study, or recreate in any of these communities, you are welcome to join this conversation and talk about what we see mothers experiencing, what fathers are experiencing, the challenges of new mothers in those communities, and do they have easy access to care? Easy access to transportation. What are the barriers keeping them from care or fresh food or a healthy home? Whatever that is, we want to make sure we understand it so that we can choose interventions that work, that respond to the needs of the community. Not just what we think will work, but what the community is asking for. And so we're looking forward to meeting people where they are and finding solutions that we can work on together in these neighborhoods to reduce the infant mortality rate in those communities.
Yeah, I'm so glad that you're doing that, because there are times when you go into a neighborhood and you says, here's what you need, but what I'm hearing is that you're saying let's talk about what your needs are and how you see it, because their perspective can be totally different.
That's correct.
Than those service providers.
That's correct.
Of what their needs are. And when you talk about dealing with, whether it's safety and those issues that impact the stress, so now you've got safety even involved to help reduce that going on there. So you're literally talking, all hands are on deck.
That's correct.
To address this issue.
And it's talking and listening. I think that's a key part of Erica's effort, is really listening. And too often people make that mistake where they just go in, as you said, and say, here's what we know you need.
Yeah. Here's the problem. We know what you need.
We know, we're from the government, we're here to help.
You.
It's really a question of listening to people, understanding their experience, and then, as Erica said, working together to kind of come up with the solution that's going to work.
Right. And I imagine that we can't expect that, okay, now I've come and told you what our problems are. I want this taken care of today.
Right.
Or in the next 3 months. This sounds to be definitely a large problem, which a lot of education, a lot of partners have to come together, and it's going to be for the long haul, though.
Absolutely.
To get this done.
Yeah.
Excellent, excellent. Well, so we talk about these things that are needed. What resources are available that are out there?
Well, I think when it comes to communities and what's available for families right now, we know that making the connections to care, prenatal care and perinatal care, and care for the infant is essential. So we've got linkages to care. We have cribs available and safe sleep surfaces.
Oh, wow.
Because we know our Safe Sleep campaign says a baby should be alone on its back in a crib. Not the bed, not the couch, not the floor, but alone on its back in a crib. And alone means nothing else in the crib with it. Not bumpers, not blankets, not stuffed animals. Alone on the back and in the cribs.
That goes totally against what
Absolutely.
I've ever known.
Absolutely.
That is correct.
I mean, we've got the dolls in there and this, that, and the other. It's been a long time ago, but with that, you don't think of it that way.
That's correct. And for families that don't have resources to an extra crib or a crib at all, we have those available at the health department. Those are no-charge cribs, and they show you how to use them properly. Additionally, we have car seats available. You know, a baby must travel in a car seat. Those are also available at low or no cost to new moms, and connections to coverage. We recognize that there are some folks that do not, they are either not enrolled for coverage because coverage is available, but making that connection for a mother-to-be to have coverage so that she can access the prenatal care she needs is also very critical. And all of those things, including support for mom while she's pregnant or mother-to-be while she's pregnant. We have partnerships with a lot of agencies that reach out and do peer support to these mothers to help them over the maternal stress. And additionally, we have home visiting available for moms just right after they've had the baby and maybe not sure exactly what to do. All of those services can be accessed by calling the health department or 311 from a landline or 645-3111.
Let me ask you this, in regards to moms, I mean, how many moms do we have out there? Have we identified, are we working with, 1,000, that are moms? Or what's the average, I mean, the rolling that we're dealing with here?
What we know is there's probably about 19,000 babies born every year in Columbus. And so those are 19,000 babies that we want to make sure live well beyond their first birthdays. It's really making our message clear, making sure people know we're out there and that these resources exist, because all these resources that Erica's talking about and more, if people don't know that they're available to them, then we're not doing our job well enough. And so it's really kind of getting the word out to everyone, not just maybe people in the high priority neighborhoods, but everyone, so that everyone understands what they can do to keep their baby healthy and safe well into adulthood.
Wow, so let me ask you this, and I think Erica touched on this in regards to safe sleep. I mean, what's the importance of those safe sleep practices?
Well, you touched on it, Napoleon, because you said, wow, this is not anything that you've ever known. Over time, the message has changed. So people will say, no, the baby goes to sleep on its stomach. No, you wrap them up in a blanket and that kind of thing. Well, what we know is research and science really demonstrates that the ABCs of safe sleep alone on their back in a crib that's empty, those are the most important things, and really the research backs it up. And if people understand that message and follow it, that's really going to have an impact on the health and safety of their baby. One of the challenges for us is people, a new mom is going to get advice from their mom, from their aunt, from their grandmother. So those of us who maybe when we had our children didn't understand the ABCs of safe sleep say, no, the baby, you want to wrap that baby up tight, put it on its stomach. So it's not just getting the information to new moms, it's getting to aunt, getting to grandmother, getting to mom, so that we're all kind of telling the same message that this is the way, that this is the safest way to put your baby to bed.
I don't know, I can hear some grandmothers out there like, they don't know what they're talking about. I raised 10 kids. I raised 10 kids, I can do this easy.
That's right, we got to get to them and get them to understand.
And just on that, that's the importance of our community-based partners. We know that the grandmothers, the aunts, the sisters, they're connected at church. They're connected in their community-based organizations. So we have to change that narrative. And we only do that by boots on the ground and really having conversations with the extended family and the support group so that they can reinforce good practices and good safe sleep practices with mom.
Wow. Well, we got about 3.5 minutes or so to go. And I got to ask, though, because there's so many partners that are happening with Celebrate One. And how does the average person, how do people get involved with this? I mean, I'm sure people watching the show and hearing about this says, you know what, I've got to get involved. How can they do that?
We've actually come up with a number of different ways that people can get involved. One of the things that we're excited about is we're going to have a Celebrate One website. It's probably going to be live anytime in these weeks. And that's going to be celebrateone.info. And all the things that we've talked about here today, people can get that information. So that's really kind of the central hub for information. At the same time, Erica's work that she's doing in the communities, there'll be significant outreach to let people know, hey, we're having these conversations. Come join us. Come join the effort. We're reaching out to area area congregations to engage the female leadership in those churches, because they can certainly play a role. And then we're also, there may be people that don't have children, or that's in their past, but they want to become involved. We're going to give up people opportunities to donate to Celebrate One, to purchase cribs for people who may not be able to afford them. So we're looking at this, if we're going to be successful in this and reduce our infant mortality rate, it's going to take everyone, and we're kind of thinking of all the ways that we can engage every single person that has an interest in this community.
Incredible, incredible, and it's an incredible program. The City of Columbus is much better for it to be kicked off, and I just can't wait to see, the great outcomes from that. And in closing, I know, just recently that you had a conversation on how we speak and think about race, as part of the program, and then also you had a kickoff or a conversation on the near South Side just recently also, and I wish we had more time to talk about how those happen. And maybe we'll have to have you back.
That'd be great.
To talk more about as things evolve and things go on, and because I want to talk about maybe some of the hurdles and the successes and those type of things. I understand you guys also have a birthday party for those who reach the age of 1,
right?
And that would be incredible to see more of that, more positive things that are going on in the community, and for all of the community, all of Columbus, to get involved in that.
Thank you.
So we appreciate the work that both of you are doing, and keep up that great work. We want to hear more about it here in the near future.
Thank you.
Thanks for having us.
So thank you so much for being here. And we'd like to thank you, our viewing audience, for being here and being engaged. And be sure to get engaged with Celebrate One. And you can do that and find out more information at celebrateone.info. So be sure to look up that website and get engaged with the community. Also, get engaged with our office. If you have show ideas or things that are going on, you can give our office a call at 645-1993 and or on our website at www.crc.columbus.gov. My name is Napoleon Bell, and have a great day.